So someone wanted to know about colloid cyst in neuro-ophthalmology, and the colloid cyst that we're concerned about is the one that appears in the third ventricle. So here are the lateral ventricles, and this is third ventricle. And so the colloid cyst is a benign cystic growth that appears in the third ventricle. And the reason it can come to neuro-ophthalmology is it can cause a ball valve effect, and that colloid cyst could lodge right here and cause acute hydrocephalus. And so the way that presents to us is acute symptoms of increased intracranial pressure, headache, nausea, vomiting, and often the symptoms are postural. If you get up or lie down, it makes it worse because the ball moves when you get up or lie down. And of course, the increased intracranial pressure symptoms, tinnitus, headache, blurred vision, and the signs, papilledema. But because this thing is intermittent, you might not see the papilledema. So papilledema is actually not required to make the diagnosis of the colloid cyst. It's just suspected based on the symptoms of ICP and confirmed by the signs of papilledema. If the papilledema is present, you have to do a visual field because we're worried about visual field loss in this setting. And of course, the diplopia, a non-localizing finding of increased intracranial pressure, usually 6 nerve palsy, unilateral or bilateral. You're going to have to do an imaging study. Normally, we're going to do a CT in the acute phase, but an MRI scan to see the cyst, and neurosurgery is going to go in there and take it out. Because it's benign, it can be removed usually completely, and it solves the problem. So the key and differentiating features are recognizing that intermittent postural symptoms of increased intracranial pressure, you should be thinking about colloid cyst. It's super dangerous because if that thing goes down there and obstructs acutely, that acute hydrocephalus can kill you. So it's one of the causes of sudden death in young people who have intermittent ICP elevation related to a structural lesion, a benign fluid collection in a very bad place called a colloid cyst.